My name is Ashley.
My name's Alina.
And we're co-founders of MindRight, a 501c3 education nonprofit that's making mental health support accessible to every child.
I'm here because growing up, my parents suffered from mental illness, but nobody ever talked about it. Later in my life, when I worked with youth in underserved communities, once again, mental health was absent when we talked about how our kids were doing. So I care deeply about removing the stigma around mental health and creating a positive narrative around mental health.
And I'm here because both of my parents grew up in high-poverty urban cities in the US. And before they graduated high school, both of my parents had witnessed a murder in their neighborhood. I want to make sure that no other child goes through an experience that traumatic without adequate mental health support. We learned that my parents aren't alone. 1 in 4 inner-city youth witnessed a murder before the age of 17 in the US. 1 in 4. Yet with 500 students to every 1 guidance counselor in the average urban school district, most students' mental health needs are left unidentified, leaving the majority of students with a pain that has no name. So if I'm a low-income student who has experienced trauma, where can I go for support? Well, clinics are often inaccessible, and there's usually no safe space at my home to talk to a therapist on the phone through telehealth. I'm not going to get the support at my school because, like I said, there's just 1 counselor for every 500 kids. I can't afford mobile apps for stress management, and there's a social stigma around mental health, so I don't even feel comfortable expressing my true feelings to my friends and family. By the time I end up in the emergency room for untreated trauma, I'm already in crisis.
So what are we doing to close this critical service gap? We're meeting students where they are, on their cell phones. We provide mental health coaching to youth over text message. We worked with our clinical advisors who are experts in adolescent psychology to build up our coaching framework and coaching content. We train coaches who then use our web platform to conduct one-on-one coaching sessions with multiple students. But for each individual child, it's just texting back and forth on their phone. This creates a safe, anonymous space for them to express themselves and get support. In fact, most of our students who have been using MindRight have told us, MindRight is the only space I have to express what I'm going through without judgment. And I tell you guys things I wouldn't tell my friends or family. We also don't wait for kids to be in crisis to text us. Our coaches reach out every day asking, hey, how are you feeling? And providing guidance in real time, and over time, helping youth build positive coping skills so they can overcome the impacts of trauma. We're scaling this model using artificial intelligence to create tools that augment the ability of a single coach so that over time, 1 coach can reach more students at a lower cost and at higher quality. We've been running targeted pilots in 1 charter school and 1 school district, and students like it. We've served 90 students. We have over 50,000 text messages. Almost all of our students have improved in evidence-based measures of psychological well-being, which is how we're measuring short-term impact. And trauma has real direct impacts on students' educational outcomes. Kids with trauma are 3 times more likely to drop out or be expelled. And so as we partner with schools and districts, we're showing how MindRight improves school attendance and academic outcomes. And in the long term, we'll track how MindRight improves the health and productivity outcomes of our target population. This is a large market. Every year, the US spends over $4 billion serving low-income high school students through Title I grants. Medicaid is the largest payer of mental health services in the US. In a given year, they'll spend $130 billion on behavioral health.
As we create social impact, we're also generating financial impact for our stakeholders who then become our customers. School districts, Medicaid providers, and government agencies, such as the Office of Juvenile Justice, have financial incentive to ensure behavioral health outcomes for at-risk youth. For every chronically absent student, school districts lose $10,000 per student per year. By increasing student attendance, by improving mental health, we'll help schools regain this revenue. For this $10K in revenue gain, we'll charge schools $60 per student per year. Second, improving behavioral health outcomes for at-risk youth will reduce lifetime expenditures for Medicaid providers. By helping at-risk youth heal from trauma, we're saving Medicaid providers upwards of $15,000 per student per year. That cost represents the cost of preventable future spending on adult behavioral health services spent by Medicaid. For that cost savings, we charge $500 per year. Third, 90% of all youth currently incarcerated in the US have experienced trauma. By helping at-risk youth heal from trauma, we'll reduce the incarceration rate and recidivism, and through that, we'll help the criminal justice system save the $150,000 per year per child that they spend on incarceration. And for that, we'll charge $2,000 per justice-involved youth per year. From these revenue sources, we expect to break even by year 3 by achieving over $5 million in earned revenue and reaching 20,000 students. We'll reach 11,000 from school districts that we're currently partnered with, and as we expand, we'll reach 9,000 from Medicaid provider that we're currently in a partnership with in DC, AmeriHealth, and we have a target of reaching 100 students in the juvenile justice system by that time.
So why us? We have an amazing team working on this. Ashley and I, we're co-founders. We met at the Stanford Graduate School of Business in the joint MBA and Master's in Education program. We have combined 15 years of experience working directly with at-risk youth. We have a full-time lead developer. He's a full-stack engineer. He joined MindRight through Andela, which is a company backed by Omidyar and Chan Zuckerberg. They train the top 0.5% of developer talent in Africa. Stephanie Marchesi is our clinical social worker on staff, and she led Boston's efforts to build trauma-informed schools. We're supported by a dedicated team of advisors, including strategic advisors, clinical advisors, including Dr. Marlene Wong, who has advised the White House on building trauma-informed schools across the nation. We have technical advisors with expertise in machine learning, and we have community advisors as well.
Through our work, we're changing the paradigm of mental health services. Right now, we're raising $500K to support our growth from phase 2 to phase 3 of our product roadmap. Right now in phase 2, our goal is to expand to reach over 3,000 students and also scale our coaching model. As we move to phase 3, in phase 2, we're also preparing our infrastructure for artificial intelligence. This will help push us to phase 3, and in phase 3 is when we plan to leverage natural language NLP models that are already existing, and we'll use those for 2 main reasons. One, to help us prioritize and triage students based on their previous information, so the NLP will help us parse through student text message data. And 2, for a classification system that will help build our content recommendation system for coaches, so coaches can, as quickly as possible, know the right content to send to students. This will help reduce our error and increase the reach of our coaches. Through our work, we're making mental health support accessible to every child. We're happy to answer any additional questions you have, and we invite you to join us in this important work. Thank you.
Thank you.
You ventured into a field that not so many people want to talk about. Mm-hmm. Yes, but my fear is that the numbers that you have are ambitious. Can you just take me across how you're going to achieve those numbers?
Which numbers? I'm sorry.
The number of patients or the number of potential customers.
Yes.
What supports that data? How did you do it? And what tells you like you're going to get from phase 2 to phase 3? I mean, there's something I just don't understand about the numbers there.
Yeah, so I can talk more about how we're going to acquire students to join our service. So right now we have partnerships with a school district in New Jersey, and that school district alone represents over 2,000 students. So in by year 3, we expect to reach 20,000, and we think that number can come from 10 school district partnerships. Right now, we're partnered with one, and we have working relationships with 3 to 4 others right now. So that's one way that we plan to reach students. The other is through a Medicaid provider. So right now, we have a working partnership with one Medicaid provider in Washington, D.C., and they have 9,000 youth members who they would like to use our service. We're actually in the process of closing a deal with them after negotiating price, but that's a huge pool of potential users for our service once we reach our scalability. And the last is youth in the incarceration system as a potential source. So that's something where we would apply for government grants to work with those youth specifically and be much more targeted pilots with that population. So I would anticipate that the majority of our users coming from school districts and Medicaid providers. And the second question, can you repeat your second question? Let me know if I can. Oh, okay. Okay.
I'm wondering if, I know Nancy Lublin, who founded Crisis Text Hotline, and they've been extremely successful, so I like that this kind of takes the same model but applies it to different contexts. I'm wondering what you've learned from them, if anything, if you've talked to them, and then secondly, how are you planning to staff this in terms of the responders on the other end of the text? You mentioned artificial intelligence eventually because it scales, so I'd like to hear more about that.
Yeah, so first, we have talked with people, with folks over at Crisis Text Line, definitely drew inspiration from them. They've been advising us partly on the volunteer model of building up our fleet of coaches, and we've talked about how we're addressing different pain points, right? So they're like immediate crisis response, de-escalate, and that's it. But, where we fit is kind of just the ongoing skill building. I mean, we refer students in higher levels of crisis to them, and then, they can refer kids when they're done talking to them to us. So it's like, here's a continuous form of support. In terms of building up, using AI, that application is to create really effective tools for human coaches. It's very important to our students that there's always a person on the other side, and we're having real conversation with a vulnerable population, so we always want to make sure we have that human element. And so, we're building up our team of volunteer coaches by partnering with schools of social work. We're a registered agency with the Rutgers School of Social Work to receive students as interns. That's one way we're going to build that up and manage that, and then the AI just comes in as a robust tool for them.
I have a related question, and this topic is very near and dear to my heart. I'm currently helping my mother deal with trauma that was long ago in her life, as she grew up in an orphanage and abandonment and those types of things. And what we found is that she was able to talk about these because she went through experiences with massage and touch, and what she was told is that you need all 5 senses, really, to talk about things that are buried deep down. And I'm wondering, is the value prop here that you believe that you can address these issues solely through text, or is it a different business model where you will, based on the segment that you're dealing with, there are some problems that you actually need to pass them to an in-person experience? I'm just trying to understand the value prop of what you can address and what you need to pass on.
Our goal is not to place in-person therapists. We see our program as a supplement to that. So we imagine this extremely long queue of youth who are waiting for access to these services that only few have access to right now. But in the meantime, we can provide them MindRight, which can help them make it through each day and give them coping skills in the meantime. And so for the answer for crisis situations, if we go to the crisis, we actually have a built-in framework for resources that we can direct students to when it becomes then therefore out of our reach. So suicide prevention, sexual abuse, eating disorders. We see one of our great value adds, we think, is that we can be a great connector and bridge for students who have no idea where these programs are, how much they cost, but we can collect that information and source it for students and direct them to that when they're in need.
And just one more thing, with the Medicaid provider we're partnering with now, one of their biggest pain points is they invested in this great behavioral health program, but the problem is uptake. And so the texting is a much lower barrier for kids to just start even understanding what mental health is, having those conversations, and we're in some cases we'd be coaching them to use in-person services.
You mentioned the volunteer team of coaches, and I'm curious, is the long-term plan to always base this on volunteers? And if so, how do you train them, and what's the quality control like around the coaches? Because I imagine if there's not a legal liability, there's kind of an emotional liability to the people you're serving.
Yeah, we've been working with our clinical advisors at Crisis Text Line to build up this program. We have we take all volunteers through 20 hours of training where we draw upon, other existing training programs for, say, teachers to provide trauma support for their students, programs that are already out there. And then, everyone gets a background check, and all texting happens on our own internal platform, so everything can be monitored. As we grow, we'll have, groups of coaches being supervised for more escalated situations. So, I mean, yeah, for us having worked directly with the students, this is something we take very seriously, and we're building that into our model.
Yeah, and we're also very fortunate to have 3 pro bono legal teams right now that are helping us navigate issues around privacy and data security when it comes to minors.
I don't doubt the savings that are possible to the various institutions you've listed, but there's a lot of situations where just because there's savings doesn't mean someone's willing to pay for the service. So I'm curious how solid it feels to actually get reimbursed.
Yeah, so I'll take that on with respect to school districts, because that's where a lot of people usually have doubt around. So my background is actually as director of operations of a charter school, and I managed our school funding. So I was responsible for making sure that our school got paid. So coming from that standpoint, I can assure you there are budget line items. Specifically, there are allocations for at-risk youth, the youth that we are targeting, and school districts and charter schools that operate in these high-poverty neighborhoods, they actually receive more money for each of those students. So I think the issue, or the challenge for us, will be how we'll anchor ourselves relative to other services. But we see the big value add that we have being that we're not just a plug-and-play service. We're personalized coaching and essentially counseling for every student. So if a school district pays, let's say, $50 to $70K per year in a counselor for 500 students at their high school, we're making sure that every single student has nearly 24-hour access to a counselor. Yeah. And for that, our price is, once you anchor it around that, our price is very reasonable for a school district.
And just attendance is a big thing, and
Yes.
Some of our kids text with us in the morning, and they'll say, "I don't want to go to school today," and we're able to catch that in the moment and coach them through that.
As of this week, it's now legal for ISPs and telecoms to sell user data for marketing purposes. Mm-hmm. I'm wondering how this exposes your business and how you're managing your customers' rights.
Yeah. I mean, we worked with our lawyers to set up our privacy policy. I mean, for us, our kids come first, and we just have this outright policy to not use the data for any purposes other than our service. And it's self-reinforcing because these are things we need to communicate to our kids to build trust, and of course they don't want their information out there.
There is no play to sell this to advertisers or their personal emotional data. For us, the one thing I will flag is that we operate as mandated reporters, so that means that whenever a child does indicate risk of abuse or neglect, we have chosen to report, serve in the role to report that to the state so that child gets the support they need. And we communicate our responsibility as mandated reporters to our kids up front so they know that.
And how do you track the impact on the kids, the results?
When kids start, they take a pre-assessment survey that uses evidence-based measures of psychological well-being, and we follow up every 10 weeks and track improvement. So for all our students who screen for a high risk of trauma, they've improved in these measures. And then because we're partnering with schools, we can run studies to show the impact of this on metrics they collect, such as attendance and academic outcomes. Thank you so much.
Thank you.